So what I was going to touch on is, and I, you know, some of this will be familiar to some of you, some of it won't, I don't know, but anyway, it's just briefly to touch on it. So as you know, we'll say new patient appointments are around 60 minutes. Currently, they are offered face-to-face, telephone, and video. So that's the choice at the moment. And similarly, the follow-up appointments are usually around 30 minutes, and the same is offered face-to-face, telephone or video. In that care plan that we offer, patients are shared care with the local consultant. So all our referrals are tertiary referrals. A respiratory consultant refers you in, and what should happen is that it's a shared journey. So your consultant, we see you, we create a management plan, and it goes back to your local consultant, and between us we look after you. That's the plan. We offer postal bloods, as you know, and sampling through our laboratories, drug delivery via it's not home care anymore, it's another company, isn't it? Or they use a courier for some patients. The GPs obviously are valuable. They assist us with the samples and all the follow-up for yourselves. You've got the access to the nurse teams, as most of you know, and access to the CARES team, which we hope you'll always use, and physio where appropriate. Some other odd things, you know, but that's basically what your appointment should look like. The discussion today is how to get the best out of your appointment, and what your expectations are. And this is whether you're new or review. I kind of wanted to get a feel for what it is, you know, your experiences, what your needs are, and importantly, do you have a plan prior to your appointment? And as we just touched on that before, this is really helpful for people. And then it'd be useful for us to get feedback about what works for you and what doesn't work for you, just so we can help you through those appointments. And so the plan is, we want you to establish what it is you need answers to, plan the things you wish to discuss. So as I said earlier, you know, jotting down any concerns, ensure you're satisfied with the consultation, and if not, follow up with the nurses or the CARES team. And as you know, Lauren touched on this. She did a lovely slide set regarding that, and keep us informed of any aspect of your care to make sure it's working satisfactorily. Then the important thing is know your symptoms, because you're all individual. So everyone's experience with their condition is, you know, differently. So trust what's happening to you. So you may all have a similar diagnosis, but it's just because you've got that label doesn't mean to say you're all experiencing it in the same way. Don't feel you're a burden or cannot ask for a question. You must ask. You must never feel that that's, you know, not approachable, or that it will affect your healthcare in any way. And, you know, to remind you that we increase our knowledge based on the information you share with us. And of course, the last one, the most important one, is to keep talking.
Hi, everybody. I'm not going to talk for that long today. It's just a quick update. There was a conference week before last. It's a conference. It's one of the big ones for NAC. It's called Trends in Medical Mycology, which is a bit dry, but it's one that all the people that are like proper dedicated fungal researchers and doctors, that's one of their really big ones. So last meeting we talked about the nodules, and that was what some of our doctors, they took that as a poster, so they were discussing that with colleagues from all over Europe, which is quite exciting. So to try and sort of drum up a bit more interest in and awareness of it, and they're going to be writing that up as a paper as well, so that's something to look forward to. I won't get into I won't try and describe too many different things, but there was a couple of papers that abstracts that I thought you might quite like to hear about. Just a little update for some of the new antifungals that are in the pipeline. And I know it probably sounds like every year we say, oh, a bit longer, a bit longer, a bit longer. And yeah, it's a slow process, but I'll just tell you about a couple of them so that you can see that some things are happening. And they are quite promising ones that are coming through now. So I don't know why they chose pink and orange. It's absolutely horrible, bizarre colour scheme. So the main thing was it was in Athens in person, but because we're the NHS, our people, you can just go online to a lot of these things now. So the first one that I'm going to mention is olorifim. You might recognise the name because there's been a lot of buzz about it, especially in the last year. So they were looking at different types of molds, like severe invasive infections. So the reason this is quite interesting is it's kind of expanding the uses in humans. It's kind of it's a way of a quicker way of getting into human trials. It's grim. What they do is they patients who have got a very invasive, very severe disease and other treatments haven't worked, basically they're in a lot of trouble. The regulations make it easier to try newer experimental drugs on people that really have run out of options otherwise. So hugely grateful for all of these patients that participated in it. And actually it did seem to help quite a few of them, which is fantastic news. So it's called a phase 2B study, which means it's not the very first giving it to a few people to see if they react badly. Like, it's kind of expanding, building on, getting a few more people through. So one of the reasons why this is such an exciting drug is because it works completely differently to azoles and echinocandins. So most antifungals, what they do is they mess up the fungal cell wall. Either they stop it making new cell wall, or they damage it, and eventually the fungus, either it can't grow or it just bursts. So that's how most of them work. But this one, it's a completely different mechanism. So it stops the fungus producing, they're called pyrimidines. It's just a tiny little molecule that it does a lot of different things inside the cell. Like it goes towards making DNA is one of the big ones. And the idea is, if you've got completely different mechanisms, then you're less likely to end up with somebody with a strain that's resistant to everything. Because if you're resistant to azoles, maybe this one will work instead. Or sometimes you can combine things very nicely. So this particular one, they already know that it's active against Aspergillus, and there's other moles that they're very rare, but they can be very difficult to treat. So they've got names that, don't worry about trying to remember them. Scedosporium and Lomentospora. They're quite difficult because they're just already resistant to a lot of antifungals. Yeah. Oh, sorry, did somebody? Oh, I thought
I'm resistant to all the antifungals for the Scedosporium. Even the combinations.
Yeah. And it's such a frightening situation to be in, because
I've got used to it now, Beth.
Oh dear. Yeah.
It's been a long time. It's been a long time. And I can't, what I find difficult is trying to make out what's coming from where, because of the other lung disease I've got as well.
Definitely, yeah.
Sorry, carry on.
Sorry. Yeah, and that sort of that idea, that also applies to a lot of people in these studies. The people that have got these really invasive infections, a lot of them, it's going to be people who they got COVID, they're in intensive care on a ventilator, maybe they've got diabetes, something else as well. So they're really, really very, very, very ill. And if we can get something that pulled them back from the edge, and that would be fantastic. So they found just over 200 people that had these invasive infections, and just there was nothing else really that could be done for them. So they enrolled them, and you know, it's so sad because like most of these people would probably have been expected probably not to make it. But with this drug, about 1 in 3 of them had a really noticeably positive, they call it a positive response. There's like all technical definitions of that, but basically like the infection was getting fought back basically, and like you could see in the blood tests and their scans that the infection was being pushed away. And 3 out of 4 people, so 75%, they were still alive after 3 months, and that is phenomenal. That is pretty spectacular. And it was really well tolerated. So some people had a bit of an upset stomach, or maybe had to change the dose a bit because their like liver tests looked a bit odd. But that's not bad compared to something like amphotericin. This is really, really good news. And they're actually starting a phase 3 trial now for the same type of thing, which means like adding more and more patients in, getting stronger and stronger evidence. And it's just it's another stepping stone on the way to having olorifim being available for lots of different diseases. So it'll still be a little while before it would be tried with CPA, but we are moving towards it, and the steps we're taking along the way are looking good. So that's a good news story.
Beth, so this is really interesting because, as you mentioned, all of the other, or almost all of the other antifungal drugs we can use at the moment interfere with fungal cell wall biosynthesis in the main, and those are useful because in the human body there's nothing that resembles the fungal cell wall, so exactly. Toxicity is really low. But olorifim interferes with DNA synthesis, and we are absolutely full of DNA.
Yeah.
So I'm really encouraged, because this was the potentially the Achilles heel. I'm really encouraged that there were very few downsides to using this drug in patients. They must be targeted in some way to fungal.
Yeah, I don't know anything about the enzymes specifically, but I could look it up, because yeah, there are so few things that fungi have that we don't. So a completely different drug that's being developed. You might have heard it before, called Sky 247. It's an earlier stage of development. So there wasn't a huge amount exciting to say about it in this abstract, because it's just a lot earlier. But there was a company that is actively developing it. They're called Synexis. Like a pharmaceutical company is actively pushing it through, and they just released some quite dry numbers about what different types of fungi it can help with and how it moves around the body. So probably most people would know, like with azoles, so voriconazole, itraconazole and posaconazole, how they move around and spread through the human body is a little bit different. So like a lot of drugs, maybe it'll get into the blood nicely, but not necessarily. A lot of things can't get into the brain very well, or sort of certain organs or tissues, or the eyes as well. Or quite a lot of drugs can't get into your eyes if you've got an infection there. Whereas this one, it seems to distribute very nicely into all sorts of organs, including lungs, brain. So that's a good sign. And it's active against Aspergillus and Candida, including you may have heard about Candida auris, which it's like a yeast. It's a sort of a superbug that's been spreading around the world, especially in intensive care units, and it's quite resistant to a lot of antifungals. So there's a lot of concern about that. But this Sky 247, it can hit Aspergillus and it can hit that. So a bit longer to wait on this one, but they're making progress. Oops, ignore that for the moment. So another one that seems to be also at a relatively early stage, but it's quite promising. It used to just be called PC945, which is impossible to remember. They've finally given it a proper name, which means once a drug's got a proper name, that means it's a good sign. That means a big company thinks it's worth putting a name on that it might actually get to market, which it's always a good sign. It's nasal, it's a new one, and it's quite an early stage as well. It's in vitro, so in a test tube basically. So it's not a clinical trial, it's before that stage. It's literally like a sort of a pet, if you imagine like a Petri dish with human lung cells in it, and then you just kind of dab the different chemicals and the different spores onto it and see what happens in the Petri dish. But it's looking pretty promising so far. So they had a little Petri dish model of mucormycosis, which it's similar to Aspergillus. It's like the nasty older brother of Aspergillus. It's another mold. It's very similar in a lot of ways. So they tried. It seems to have activity against Aspergillus and mucormycosis. And when they kind of did a little scientific trick where they kind of layered the experiment. So it was a bit like you could kind of put one drug on one side of the cells that was like the inhaled drug, and a different drug underneath them to be like systemic. So like if you took a tablet or an IV, to mimic if you're in hospital, if you had the inhaled one and you're also having an IV both together, and they were synergistic, which means if you give them this drug and posaconazole, it's better than either of them, than both of them. It's greater than the sum of its parts, basically. The effect you get, they work together really nicely. And the reason there's a picture of a dragon on the previous slide is, I was joking earlier with Graham, it's kind of, I don't know how true it is, but opal console, I think it's relates to that, it's like a bit of an iridescent-y colour. And we were saying that, oops, when you nebulize it, if you breathe out and it's sort of iridescent, that might be like nebulizing's not fun, but it might be slightly more fun if you can just pretend to be a dragon while you're doing it. Just take your wins somehow. Yeah. So that's quite good, and that's different from I think previously we've talked quite a bit about the inhaled itraconazole, whereas this is a completely different drug. So that means there's 2 inhaled options in the pipeline, which is really, really great, because you get, if you inhale it, it's going straight to where you want it to act, and you don't get as many side effects. So this one isn't a treatment. It's just quite an interesting one. It's to do with the immune system and Aspergillus. So again, it's the very, very severe invasive disease that they're looking at, just because it's a lot easier to study, because it's sort of very quick and dramatic, and there's a lot more funding for research into the invasive form, but it does all link together with chronic forms as well. It may trickle down later. So there was a trial, it's called Optifil, it was in France, and what they were looking at overall was when somebody's had this severe invasive form, and then is recovering from it, sometimes it can be a bit difficult to track their progress in recovering, because sometimes if you do another scan and it kind of doesn't look that different, or you do different blood tests and maybe they're a bit variable, or you're not sure how much use you're getting out of them. So they're going through that to try and find a kind of a real fingerprint for how do you know, how do you track along whether somebody's recovering well or not. So that was the overall study, but at the same time, as part of that, they did a little sort of immune sub study. So they were looking at T cells, which is that weird blob you can see in the corner. You get different types of T cells, like white blood cells, against different pathogens. So these are Aspergillus specific ones, and they produce interferon gamma and something called IL-10. So those are sort of immune signaling chemicals. So they wanted to see, you know, in different patients who had good levels of these cells or not. It's really, really, really hard to measure, apparently. So even just for practical reasons, they only got to run about half the tests in the machine, because a lot of the time it's very difficult to get the samples. Like if somebody's in intensive care and there's a lot going on, it gets really chaotic. So you don't always get the samples, and then things get stuck in the post, and then something like the sample, like it's got a weird consistency or something, and it won't go in the machine. So it's really, really, really hard to study. So they did well to get any data out of this at all, I think. But it was quite interesting. So they wondered, like, if you don't have enough of these cells, does that predict whether you recover or not? So at the start of the experiment, about half of the patients had like a pretty good level of these cells, but there were 3 patients who died, and all 3 of them just completely lacked these cells. They were absolutely undetectable, which means that layer of protection against Aspergillus, it just wasn't there.
The situation in October was that we were seeing signs of a slow but steady autumn surge in COVID cases being admitted to hospital. Okay, this is the whole pandemic in terms of numbers of people have submitted to hospital, and this is now. Here we got July here, and we were, as of up to October, we were going up and up and up and up and up and up and up, very slowly, very gradually, and at a much lower level than any point in the previous pandemic. So obviously this virus is getting less dangerous to everyone. And we had started vaccinating around this point. The more at-risk population, the sort of over 60s, I think it is. And we were looking for this to peak, and maybe I think we were about here the last talk, and it looked like it was still going up. But what happened in the following month of October was that it seems to have eventually peaked and is now consistently falling. So that's good news. That looks like, for now anyway, the worries about that being a long, slow build up to maybe something bigger around New Year have been put on hold. It's not currently happening. Looking at the variants that might be causing this is the one, BA286 Parola was the one they were worried about, and we've now seen a few hundred of these people who've been infected by this variant, and it's no different to all the other Omicron variants in how it's in its severity and the severity of the symptoms it causes. So worry about that seems to be fading fast, and of course most of us are have had our autumn booster now. I think everyone in this group should have had the autumn booster. I've also had it, and boy, didn't you know it for the first day or two. Well worth having. Flu on the other arm, didn't even notice it. So you take your choices. That's probably played a part in making this particular surge peak and start to fall. I think 70 by the aim was to get everyone vaccinated by the end of October, and I think they succeeded with nearly 70% of people over age 75, which is not far off a technical definition of everybody when you have people who probably don't want it at this stage, and so on. So that's kind of good news. The latest surge seems to have passed. Risk of hospitalization is very low and falling. stay protected in the usual ways, which we're all familiar with. Even if you come into one of our new expanded packed clinics in our waiting room, get vaccinated and live with it is essentially what we're still saying on this one. Nothing unexpected is out there to worry about. So that's and yeah, so UKHSA, the UK Health Security Agency, if you remember rightly, were brought in to replace, I think it was NHS England in their antivirus strategy about 18 months into the pandemic. And they've now produced this nice dashboard which shows us the status of all the common respiratory viruses that we're liable to get in the UK. The main one we're worried about at the moment is flu, on top of COVID, of course. And there's absolutely no sign yet of flu surging in the UK. So that's also good news. This has been a request, and the person who requested it isn't here. So we can all blame them because they're not here to deny it. That I do a quick summary about indoor air management and why ventilation is so important and what's causing the problem. So in order to carry out this assignment, and this is being recorded, so the person who requested it will be forced to watch it.
Yes.
I have to talk about humidity. Okay.
Oh, yeah.
We're all aware that humidity in your home is something to be discouraged, but what is it? Okay. In fact, humidity, the word humidity is almost a shorthand. Humidity is water vapor suspended in air. You can't see it. It's perfectly dissolved in the air. It forms part of the air. It's quite difficult to measure easily and cheaply. So we rely on a measure called relative humidity, which can be measured with these little gadgets. And this one I've got here, I think, was about £6 on Amazon. Other suppliers are available. And all it's telling you is how much water is in the air relative to the maximum amount of the water the air could hold. So that's why it's called a percentage. So this is in this example, this is at 52% relative humidity. And as you can see, that's comfortable. We'll talk about that in a bit. And so that means is 52% of the total amount of water that your air can currently hold is occupied with water. This figure changes according to the temperature of the air. So at 25.8 degrees C, we've got 52%. Okay. The warmer the air is, the more water it can hold. And the colder the air, the less it can hold. All right. Told you this was exciting. So, relative, in another way, there's this amount of water in this circle, blue circle. So we've got that amount of water vapor. It's at 10 degrees C. Okay, there is no spare air, no spare capacity in the air at 10 degrees C. So this is air at 100% relative humidity. If we put the temperature up to 20% with the same amount of water, that air can now hold much more water. So we're only using half the amount of water that air at 20%, 20 degrees can hold. So we're talking about nearly half, 52% relative humidity. Same amount of water in the air, but the relative humidity is halved. This is why it's not easy to use the measure of relative humidity to tell somebody how much water there is in the air, because there's the same amount of water and half as much relative humidity in these two examples. And if you push it up to 30 degrees C, the water will hold even more, the air will hold even more water vapor. So now we're only at 28% of what it could hold. So it's 28% relative humidity. Why is that important? I may say this on the next slide, but I'll mention it here. At 100% relative humidity, that water, if you can imagine, that's almost like a balloon blown up, and it's got so much water in it relative to the amount it can hold, it can't hold any more. 1% more, and this balloon is going to burst, and all the water will come out of a vapor and will turn into liquid water and literally drop onto whatever's around, or settle onto whatever surface you've got in the area. So it's about the temperature as well as the amount of water. Now, the other important factor is the dew point, which I don't know a huge amount about, but I can go through it. As the temperature drops and goes past the dew point, we're all familiar with dew on the grass outside. That's caused by, at night, the temperature of the air drops outside, and as the water as it cools, water relative humidity hits 100%. It passes the dew point, the water condenses and starts to fall out of the air, just as I've said. And that outside, that ends up on the grass, and you can see it in droplets, and it can look very beautiful and on spiders' webs and all kind of things. It's exactly the same process if you invert the sky. Water vapor that's warm can rise up into the sky. When it hits a certain level, which is the dew point, because as you go up, you get colder. When it hits the point at which we've got the dew point in the air, then clouds form, because clouds are essentially water droplets that are condensing out of water vapor in the air, and eventually we'll get rain. So it's not the situation you can get in a home with too much water, well, let's say too high relative humidity, is not unlike having a cloud in your living room that's poised, ready to rain in the middle of the night when the temperature drops because your heating's off. Of course, another way that this cooling can happen is if the air meets a cold surface, and that's the thing that we're most familiar with. If there's lots of water vapor in the air in your home, it's very quickly, like if you're boiling a pan or a kettle or something in the kitchen, you'll very quickly see your windows steam up. You very quickly see it in a car, as if you get in the car, your windscreen will steam up because of the water vapor in the air that you're exhaling onto that glass. Also commonplace is cold water pipes, and there can be patches of cold on walls as well. Anywhere that this air meets a surface that's colder than the dew point temperature, you'll get this condensation. And importantly, the higher the relative humidity of the air, the higher the dew point. So if you let the air in your home reach a high humidity, i.e. above 80% relative humidity, then the temperature at which this dew point will happen and the water will drop out all over your home is also higher. Okay, so during the day, the temperature in your home is probably around 20 degrees C. I know that's what mine is set at the moment. And the air in your home might be at 50% relative humidity according to the device you've just set up in your home. Then night comes, you go to bed, the heating turns off, but you haven't ventilated. You're in one of those homes that's pretty airtight, and all that water vapor trapped in the air can't get out. As the temperature drops, because your heating's gone off, and even if it only drops 5 degrees C, the amount of the water that air can hold decreases, as we've just discovered. So the relative humidity increased to 75%. Even though there's the same amount of water in there, your relative humidity is getting higher, and the risk of hitting that dew point is higher, because now the dew point temperature is higher because your relative humidity is higher. If the temperature now continues to drop, and at this time of year, it's a really good time of year for this to see this happen, because it's starting to get colder outside, especially at night. We're down to sort of 4s and 5s. So indoors we might get a temperature of 10 degrees C. You've now hit 100% relative humidity and 10 degrees, not far below 10, or it might even be 10, because there are other factors involved in this, including air pressure. That water will start condensing out, and not just condense onto your windows, it will condense onto your carpets and onto your soft furnishing. It just drops out, and the following morning you'll be wondering why some of your soft furnishings feel a bit damp. That is why. And yeah, so how do you stop it happening? Because that is not a great situation. As soon as you've got damp on your soft furnishing, on your curtains, on your carpets, you've created conditions for microbes to grow and a variety of other things, which I'll talk about in a second. You want to try and avoid that happening. You need to stop water leaving the air and being dumped over your home. Okay. So there's a few options, in theoretical options. Keep the air temperature warm. Leave the heating on in your house. You will never reach the dew point because your heating is keeping the temperature of the air high, but you have the downside that you probably end up with a large heating bill. And if it was my house, I'd also end up with a very angry wife because she doesn't like sleeping in hot, warmed air, and neither do I. Another way is to eliminate cold surfaces on which condensation can happen. However, that's virtually impossible because we're talking about windows and we all need windows. It's also difficult to find all these cold surfaces. You can have, a lot of people will have their water pipes boxed under the, either boxed on the wall or hidden under the floorboards. The damp air will penetrate into floorboards and through any gaps in boxes and so on quite easily. They'll find those cold pipes and they'll be condensing all over those cold pipes, and you'll be getting mysterious drips from nowhere from the middle of your ceiling and places like that. So yeah, also really difficult. Option 3, remove the water from the air, reducing relative humidity and lowering the dew point. That is probably the easiest to achieve of those three. So let's see how we might do that. How do we remove water from the air inside our home? Well, there's a huge reservoir outside your home of cooler, drier air almost all the year round in the UK. At the moment, when the outside air is hitting sort of 4 degrees C, it's gone past the dew point, all the water's dropped out onto the grass, and you've got beautiful dew on the grass, but that air is now dry. If you bring that air into your home and mix it with the humid air in your home, the overall levels of humidity are going to drop. Okay, so that's desirable. So this is what we achieve when we leave windows open, for example. And the colder the weather, the better. The colder the air, the drier the air. So colder is better in terms of humidity. Mix the colder air from outside will lower the amount of water vapor in your home. Warmer, moist air leaves your home, cooler, drier air enters. This can be done with just leaving your windows open. This can be very cheap. There's another way, and that's to use dehumidifiers. Now, these are very good. We have a few problems with them. They can be capable of extracting many litres of water from the air in your home every day. And I read an estimate while I was writing this, that the average family of 4 generate about 16 litres of water in the air every day. If you've got a machine that will extract 16 litres, you might have reached a nice level of equity, and what's coming in is being taken out. That's great. Snag is, you might need more than one, at least one upstairs and one downstairs. These things of the appropriate size can cost you hundreds of pounds. You might be able to afford that, but they're also quite demanding on the energy. Biggest one I saw was running at 0.5 kilowatt per hour, and that translates per machine £3.24 per day per device. Not cheap. That's £100 per month per machine. So can be done, but not ideal. There are particular human factors that we need to consider that will encourage us to keep relative humidity down. And these things that maybe you're not aware of, I wasn't aware of one of them. When it is hot in your home, if the air is approaching 100% relative humidity, this could be during the summer. So the hot air outside is getting into your home. The hot air is also very damp, as we know, when we start getting winds coming from the wetter parts of the world across the UK. It gets very, very humid. And what happens, you start to feel sticky, you start to feel uncomfortable. And the reason for that is your sweat will not work as well to cool you down. At 100% relative humidity, your sweat has more trouble evaporating, and it's evaporation that cools you down. So this becomes much less effective at keeping you cool down. So what happens? You sweat more and you've got to drink more, and it all gets very, very horrible very quickly, especially if you haven't got a swimming pool or something like that. So that's not good. That's something we're all familiar with, and that is why it can be quite hard to keep cool in the summertime if the relative humidity is high. What I didn't appreciate so much, when it is cold in your home and you've got a lot of, and you've got humid air, so evening colder air, say at 10 degrees C, if you've got that 100% humidity, or relative humidity, I should say, it is now more expensive to heat that humid air because humid air is much more difficult to heat up. Therefore, it's going to be more expensive to heat your home if you don't keep relative humidity down. I didn't fully know that, so that's quite a surprise to me. But it's well worth knowing. So, causes lots of damage, as you might. The thing that we're most familiar with is moisture encourages microbes and allergenic molds to grow on the walls and that kind of thing. But also, if it's completely out of control, which it is in some buildings where maybe there's a lack of awareness that this could be happening. I'm imagining a home at this time of year, elderly people have got the temperature about 25 degrees C to keep warm, got the windows shut. I'm thinking of one elderly person in particular at the moment. That's going to get really humid in there quite quickly. And if you've got, say, a cold water pipe behind a board, that's going to be dripping with water under these conditions. Water dripping onto lots of different materials like plasterboard is quite destructive and will need replacing and repairs, and it all get pretty horrendous. Some materials, when it gets wet because of condensation, can off-gas irritant gases which can make you cough. And there's a whole load of other stuff. Damp homes actually can have more insect and rodent life. Allergies, respiratory, as we all know, skin and throat irritation, bad sleep, and from personal experience, I had an electrical trip go off because we've just cooked in the kitchen and there was an exposed plug in the kitchen, and we had to turn the entire house off because the electrical trip kept going off until we traced it to this open plug in the damp home. We opened a couple of windows, the condensation disappeared and the tripping disappeared as well. So let that be a lesson to me. Okay, so what are we doing? Haven't really got time for these. Let's try one. I'm just going to break up things a little bit. Different types of ventilation. Let's see if this will run. Okay, you bought a new home and the guy comes along who wants to ensure that your home doesn't get too humid, and he asks you to drill holes in it. You've paid thousands of pounds to seal it up with new double glazing and so on, and now he wants to drill holes in it. That's the dilemma, and this cartoon is 5 minutes long. So let's see what happens.
Beautiful screen.
Imagine spending several hundreds, if not thousands, on insulating your home to be told you have to put holes in it to let cold air in. Or imagine building a new home to new energy efficient standards, and again, the better it is, the more holes you are told to put in it. Well, this is exactly what people are being asked to do. So why? Let's explain. While we can't control the cost of fuel, we can control how much energy our buildings need. And the less energy our buildings need, the more people we lift out of fuel poverty, improve society and the environment. This common sense energy approach is what fundamentally drives increasing standards in new housing and national programs for improving our housing stock. But as we rush to seal our homes from the cold, we should remember we have to live in them too. And live in them we do like never before. In fact, we spend up to 90% of our time indoors, where the indoor air quality can be many times worse than the air outside, causing a range of problems, including respiratory illnesses. So we find ourselves in a dilemma. A bit of a tug of war, if you like, between closing up our homes to seal in the heat and opening them up to let fresh air in. Ventilation is basically the mechanism by which we do it. Take bad air out and let fresh air in. So what is bad air? Well, actually, it's mostly caused by us and the stuff we do. And other than ventilation for things like fires and boilers, it can be broken down into three main groups. Moisture. That's cooking, washing, drying, and so on. The average family of 4 can produce 16 litres of moisture in a week. If the moisture is not dealt with, it condensates on cold surfaces, causing mold, which damages our home and proves an ideal environment for other nasties too. Great if you have asthma. Metabolism. That really is us. CO2 from breathing, which includes more moisture and of course odours. While odours are just unpleasant, too much CO2 for too long is not good for us, affecting concentration and causing fatigue amongst other problems. VOCs. These are quite complicated and are basically chemicals that we don't really want about. The vast majority are okay, but some are very bad, and we try not to have them in our houses in the first place, in paints and varnishes, etc. But we do have to mitigate the risk with good ventilation. Some pollutants, like moisture, are easier to spot. When we have a shower, for example. The problems it causes can also be very visible, mold, but others are less so. It's a bit like boiling a frog. Bear with me. It would react to boiling water as you would imagine. But if you sit it in cold water, then warm it up slowly, it will sit there quite happily until, well... Put it another way. Have you ever been into a teenager's bedroom? That's the indoor air quality equivalent of jumping into boiling water. The occupant, probably still asleep, seems quite happy there though. In short, we can be just terrible at recognizing poor air quality, especially when it builds up around us slowly. In the context of a simple ventilation system, your humble hole in the wall, do we really expect to get up halfway through our TV program and open it up a little, or close it before bed to control CO2? Of course not. What we tend to do is, the first time we feel cold air coming in, we shut it, and often leave it that way. And herein lies the rub. Until now, we mostly got away with it because, well, So much of the air that came into our buildings got there through leaks. But as we build more airtight homes or seal up our old ones, we rely more and more on ventilation. So when we close a vent or switch a fan off because it's noisy, how else will the air get in? Are we slowly turning ourselves into frogs? To ignore or not integrate proper ventilation systems into our homes is simply leaving ourselves open to risks that shouldn't be acceptable. Although a hole in the wall has its limits, there are now many better alternatives. Proper, well thought out ventilation secures good indoor air quality and provides a comfortable and energy efficient environment for us all to enjoy our homes.
Thank you.
If your current
Okay, so you kind of get the gist of that. It didn't run in at full panel for some reason, don't know why. Essentially, ventilation is very important for a whole variety of reasons. The next video actually shows you the different types of ventilation that there are. But for the most part, most people are only interested in something that's a cost-effective solution, which is opening the windows on both sides of a home, so you ensure flow through is the best way to ensure that ventilation happens. Okay, be aware that the damp gets into all of our homes from a whole variety of sources. We've talked about a few today, but there are many more. If you can go around identifying them, you can control and reduce those sources as much as you can. You do need to keep your home relatively warm to keep that moisture in the air while you're getting rid of it. If it falls out before you ventilated it, that's no good. The home has to be kept relatively warm during the day, so that you don't get a big dump of water in the night time as when room temperature drops. Ventilate thoroughly during and after loads of water vapor is being after lots of water is being produced, I should say. Keep ventilating, keep those windows open until all those surfaces are dry, then you can close the windows. Remember that you also produce water vapor as you breathe, and so do your pets, so bedroom ventilation is also important. Keep on top of all these sources of damp and you will virtually eliminate the problems with damp causing your home. Okay, and I think I'm out of time.